Yeah, good morning, ladies and gentlemen. My name is Dr. Marina Njelekela. I come from Tanzania, and I'm very grateful to bring to you today an idea from my country, from the Medical Women Association of Tanzania. The Medical Women Association of Tanzania is an association of female medical doctors who have joined together to address the issue of breast cancer awareness and screening. So Tanzania is a country which is located within East Africa, as you see the map there, with a population about 40 million people, with an area of about 947,300 square meters. Tanzania is a very poor country. The per capita income at the moment is around $500. The health system in Tanzania is really struggling, but we have made a little progress in our health system. For example, the expenditure for health system is increasing. The infant and under 5 mortality is going down, and also the prevalence of HIV/AIDS is decreasing. Looking at the cancer burden in Tanzania, you see that in this slide, we have female on the right side and male cancers on the left side. The first and foremost common cancer in Tanzania is cervical cancer for women, which accounts for about 51 on the incidence rate. And the second commonest reproductive system cancer is cervical cancer. So you see these two female reproductive cancers are among the commonest in my country. However, despite the fact that we have these high rates of cervical and breast cancer, the cancer management in my country is really struggling. And it's struggling in the sense that we have some of the cancers which are now becoming like epidemic, like cervical cancer. The whole country of 40 million people have only one cancer center, and we have extreme poverty, especially among women. Also, in our cancer center, we have recurrent cancer chemotherapy stockouts, and the general awareness on cancer is low. We don't have any screening program for cancer, like prostate, cervical cancer, or breast cancer in my country. So really, the health system is struggling. So in view of all this, the Medical Women Association of Tanzania came together to complement the efforts of the government to address breast cancer control in my country. And during this time, a group of female doctors, usually 30 to 50, will travel from Dar es Salaam, which is our main town, to regions across the country to create awareness on breast and cervical cancer and to train our fellow medical doctors on how to do breast self-examination as well as cervical examination. The program usually is sponsored by the general population, that the well-wishers, and some funds from the government. The program has 3 phases. Phase 1 usually is mass screening and training. In phase 2, usually we do breast cancer diagnosis, whereby in-depth investigation is usually done. And during this in-depth investigation, we do fine needle aspiration and cytology, we do diagnostic mammography, and we also do open biopsy. And at this stage, as you see in this picture, we usually communicate or collaborate with men doctors who are usually surgeons, anesthetists, nurses, who work with us to complete the diagnosis. And the third stage, after we get diagnosis of our patients, we usually refer them to our only cancer center in Dar es Salaam for further treatment. And also we cover the treatment for these women who are diagnosed to have breast cancer. This slide shows the results of our breast cancer awareness and screening campaign. You can see we have gone in 7 regions in Tanzania. We have managed to screen about 63,983 women, and we have diagnosed about 152 women with breast cancer. And apart from this, the biggest achievement which we have had is the increase in awareness in the general population as well as in the policymakers. And we have managed to create changes within the Ministry of Health so that they have a cancer section within the Ministry of Health. Apart from the awareness among the general population, even we have seen quite a big influx of patients in most of our hospitals. However, we have challenges. Look at this picture. This picture indicates a woman who presented to us during one of the breast cancer campaigns, and she came with an ulcer. She stayed at home. She was not aware until all the breast was eaten by the cancer tissue. So this is one of the biggest challenges which we have about myth and misconceptions about treatment on breast cancer. Many women don't come because to us in Tanzania, cancer is breast cancer in particular is equated to death. So we have a very serious work to continue doing. But as well, the health system is not ready to receive all these women. We are working on the program that with the Ministry of Health, if we can improve the health system to address women cancer issues. However, the policy issue which we are having a problem in my country, we don't have a national cancer policy, which we are working in now with the Ministry of Health, and we hope it will be finalized soon. So it's my great pleasure, Lily, to thank you, Cynthia, for inviting me to share this program in our country, and I hope we can continue working together. Thank you for your attention.